Welcome to DC2B Revolution, helping chiropractic students think big in order to live large. I'm your host, Volz, and today I'm here with Dr. Tim Brown. He's one of the most forward thinkers in the country, especially when it comes to healthcare. He's an incredible doctor and an inventor. Was the head medical doctor for the World Surf League. He's an IntelliSkin inventor and the godfather of functional taping. So, Dr. Tim Brown, thanks so much for being here.
Hey, it's stoked to be here with you guys. Thank you for asking me.
Yeah, my pleasure. You've done a lot. You've been out in the field for quite a while. I'm sure you've seen a lot of things in that time. Is there anything that you've noticed that's really relevant for chiropractic students in terms of either the things that chiropractic students are doing right, or the mistakes that you see, or the misconceptions that you see once they, get out into the field?
Well, nothing like a 50,000 foot view there, huh, Noah? It's there's so many different silos to go down there, but I think probably the one that jumps out, entrepreneurs, bottom line. And until we take responsibility for our own business practices, we are kind of a mark out in the business world, and people are out there to take big advantage of you. You're going to have all this potential income coming in, but unless you know how to put it in the right places and know how to make that money work for you, it will work against you, and it will hold you back in your practice and your ability to help a lot of people. So understanding business, really not just being a businessman or a businesswoman, but being an entrepreneur. Those are completely different animals. As an entrepreneur, you have to wear many hats. And the sooner you accept that responsibility, and trust me, it was like drinking cod liver oil for me. But in the end, that's the lesson that you learn, is that the more you can take on yourself as far as responsibility goes and how the business is running, from accounting all the way through what your assistant's doing every day and the insurance stuff, the better and more effective practitioner you're going to be, because you're going to be a part of that system as opposed to an outlier like I wanted to be, instead of really kind of conforming to common business practices that we all need to understand. You need to know what a balance sheet looks like. And you need to be able to sit down with somebody and speak at least intelligently about that stuff. And so that's another part of it. And I hate to lay more stuff on you, because I remember in school we had the joke that, they don't teach you much in school. In fact, it happens in one day, and if you miss that day, it's going to affect the rest of your career. Well, it's not quite literal, but by not having that business understanding, I think we put ourselves really in arrears in our abilities to help a lot of people.
Yeah. So, what would you say were kind of the big influences or mentors who guided you through the counting and the balance sheet and being an entrepreneur? Did you have any individuals or any stories that come up for you where you kind of learned how important that was?
Well, I just got beat up for a long time. I wanted to be this guy that was out on the sidelines working on these athletes. I got a really great opportunity early on to, as a pro beach volleyball player, after playing college football, I went into pro beach volleyball, and I didn't expect to be a top pro beach player, but I was good enough to qualify for a lot of the events on the tour. So I would go ahead and compete and lose pretty early, and then break out my table, and then start taking care of some of these guys who were the best in the world at that time. So that was kind of how I fell into this incredible opportunity of learning how to take care of the athlete, the best athlete, and being able to implement what I always wanted to have as an athlete, which was an interdisciplinary approach, where you could have allopathic care as well as natural care, and the options that fall in between there. So I'm a guy with a real open mind, and medicine is a fantastic profession, but we also have something that's just so incredibly valuable to offer. In fact, the MD, oftentimes we kid a lot on the surfing tour and the volleyball tour. Oftentimes the MD's in the corner reading the sports section, while we're out there taking care of the athletes. And it's great to have them out there. Don't get me wrong. They're super valuable. When something real traumatic happens, trust me, you want them there. But the real, guys that are in the foxholes and in the trenches, getting dirty all day, they're your sports chiropractors. They're your PTs and athletic trainers and soft tissue specialists, performance specialists. Those are the guys that you really end up working with, and learn how to respect them because they do something a little different than we do. And those little nuances, when it comes down to, you got a 5-7 minute injury timeout for an athlete, he's got to go out and make money. You want those assets right there with you. And you really learn to work with your fellow practitioners. And that was a huge lesson for me. So I passed on the business lessons, but learned a whole lot about clinical care and what to do in the heat of the battle and how to keep it cool and, how to solve problems. And that was really kind of been the direction of my career. Is I work on athletes that play in the sand and are in the water as surfers and pro beach volleyball players. So different in taping, different approach to treatment, different environment that you're treating them in. So it was a great way to kind of cut my teeth and learn from some of the best doctors in the world, regardless of their specialty.
Yeah, I mean, you covered so much there, and I know that chiropractic students are going to have a lot of questions about that. I feel like probably the big question that I come across a lot is, it seems like every chiropractor these days wants to work with athletes, especially high performance athletes.
Yeah.
Can you talk about kind of the mistakes or the misconceptions that chiropractic students may have about working on athletes, about that lifestyle, and maybe dig in deeper to what it is like to work in that multidisciplinary environment?
Yeah, that's a great question. Thanks. Well, I think the thing that comes to mind is that we learn as chiropractors to adjust the spine, right? I mean, that's where we focus on. And one thing that often wasn't talked about, and I went to school, almost 40 years ago. I know, so I'm ancient, but what wasn't talked about is why they need to be adjusted. What is happening in the body for them to have to come and be adjusted 5 times a week for, certain people's care paradigms, care programs, or 5 times a week for a month or whatever they say. And a couple things. We don't know how the body's going to respond. Okay, everybody responds differently, and it's not always just based upon their history. It's also what they're doing in their 24/7 during their day. So what I learned was that when you can approach the athlete by why they need their spine adjusted, what is going on in their muscles and in their 24/7, whether it's their training or in their time off, that's causing the muscle imbalances that pull on the spine, that pull it out of alignment and keep it there. Because, and frankly, in my experience, just by adjusting somebody, you can give them relief. But, no, I never wanted to be a Band-Aid or an aspirin. I really wanted to help solve why they needed to be adjusted. And that is a deep dive into anatomy, physiology, and fascia and function. And so that's been the rabbit hole that I dove in. And, I really don't know anything relative to what I need to know out there, Noah. And I've been passionate about it since I was 14, let alone what I've done, in chiropractic and sports chiropractic. So there's a lot to learn. It's a big open field out there. Don't think that the problem's been solved. But getting back to your question, misconceptions that you're going to come in and help a guy's back or a girl's back by working on their back. Okay, that's really how we look at somebody. And I'm not standing here and sitting here in judgment, but when someone interviews with us to say, hey, I want to work with professional athletes, it's a pretty quick interview in the sense of, okay, I got a bad shoulder. What are you going to do for me? And they, look at the shoulder, maybe examine the shoulder, and they say, well, you've got a rotator cuff problem based upon this. What I'm going to do is I'm going to work on supraspinatus, infraspinatus, and so forth. And I'm sorry, it's, I got to ask you to try again, because if you have to work on what's hurting, you really don't understand the problem. And I think that's a really intimidating message, but it's an important one. And until you get there, maybe you're not the one that should be working on that professional athlete. So it's really learning the causes. And we know that, I'll go a little deeper here, but the mobility, stability, and strength paradigm is a really neat paradigm. It's super awesome, and it answered some of our questions. But look, every athlete in every sport at every level is more in danger of being injured than they ever were. So what are we doing? I've been in this almost 40 years. How good does that make me feel? Not very good. So we are gaining. We're smarter. We've got great science behind what we're doing. Yet the athlete is still always injured. So I've jumped in the last year to kind of claim a new paradigm with a lot of the people that I work with, and I think chiropractors are really going to love this, because the first step in fitness and health, in my opinion, is alignment, and that's based upon all my clinical experience as well as what's in the literature. It goes like this: it goes alignment, diaphragmatic breath, and then once you have those things down and you understand and can demonstrate what does it feel like to be in alignment, not only when you're static, but also when you're moving. And then also show me a diaphragmatic breath. Show me how you breathe into your low back. And until they can do those things and demonstrate those things, they're not even ready to start mobility training. They're still in the DNS phase, where they're in the developmental stages, and they lost that development as we go through school. We all move great when we're age 4. It's probably about the best we'll ever move. And then what happens at age 5? We start school. We start sitting. And we are not built to sit. We are built to move. We're actually built to run away from things that are chasing us. So movement is just really a huge part of it. So, that's the other piece of it is learning what they're doing, the athletes doing outside of their sport, outside of their training, because you got to recognize that they're doing that for more hours than anything. And if you can create better choices for them there, that's also another piece that'll win you over to that higher level athlete, because they know that you're not just thinking about X marks the spot that they pointed to that's hurting them holistically, as opposed to with the reductionist modality or model that we all learned in school, right? Learn about the heart, learn about the chambers, learn what's connected to it. How the fuck does it work with my foot? I don't know. It all worked together. And until we really get that into our blood and start working on kind of connecting subsystems as opposed to pieces of the body, like you're not breathing right, got to get that transverse abdominis to fire right. Well, nothing works in isolation, Noah, right? We know this. And so it's great to work on transverse abdominis, but not unless it's with a movement that involves a whole package.
Yeah, I mean, you're speaking my language. Before coming to chiropractic school, I've been teaching yoga for a really long time, and exactly like you were saying, if I'm trying to adjust the rib cage, I'm usually working on the foot and stabilizing the foot to get whatever movement I need in the rib cage for that particular student. So, looking at the whole movement and the connection from the fingertips to the toes of that movement, and then figuring out where the kink is and figuring out where the alignment isn't right, and adjusting that in a really intelligent way. I love how you put that, and how I was able to see that from my own background. That's beautifully articulated. I wanted to also talk a little bit about the brace, the IntelliSkin that you created. I wonder if you could talk a little bit about how your experience with athletes kind of moved into the creation of this product, and a little bit about that product.
Yeah, thanks, Noah. I'm definitely not the sharpest tool in the shed. I played college football, a lot of concussions, so things take a while for me to really kind of get a grip on, but I'm a pretty good observer. And so what we found in on the tours, beach volleyball and stuff, we're treating athletes between heats, right? So they may be out on the beach for 8 to 10 hours in a day. They might have 5 matches. They might last an hour each match. So there's a lot of work that goes on between them to try and unwind them from their former match, hydrate them, make sure that they're breathing properly. All those things have to happen during those timeouts. So what happened was I went out as a chiropractor, right? I was fresh out of school, and my biggest tool was the adjustment. But I learned pretty early on that adjusting is a great tool, but it's not going to get you where we need to go as far as long term. So I started to recognize a lot of muscle imbalances that were very consistent with volleyball players. And I started to, I really don't know why I started to do this other than the fact that I knew about the Arndt-Schultz principle. And that's if you go deep on somebody, you're going to disconnect their nervous system from their brain and their muscles, and they're actually going to maybe feel great but not play very well. So that's why we don't go deep on athletes, right, when they're in competition. So I thought about, well, I want to work on those muscles, but how can I get to those muscles without sedating them and actually improving their function? And so I found out about this guy, Vladimir Yanda. And, somebody, I think a physical therapist turned me on to him. And I had just started working with my taping at that time. And people were writing the AVP, they're writing, because we were on TV a lot, they were writing them saying, what is that medical director on? He's putting like 2 strips of tape on people and think that's going to help somebody. And this was late 80s, early 90s when I was able to kind of start working with some of these taping things. And so in the next couple of years, they continued to harass because they just weren't used to seeing athletes treated with a couple of pieces of tape. And so all I knew, Noah, was I didn't know what the tape was doing, okay, honest. I just thought what I was trying to do was replace the damaged anatomy, but do it on top of the skin, as opposed to having to go in there and button it up surgically. If it was a rotator cuff or an inversion sprain, I would just literally make a crease in some hard tape, some classic tape, what we call Leuco tape, and then I would make a tab out of it, and I would pull the tab into a position where it levered over the ligament. And so I was replacing ligaments and then putting kinesio tape over the top of it and creating these soft tissue systems, these exoskeletons on the patients. And I didn't really, like I said, know what I was doing. I just knew that the line was growing every week outside the tent to get these taping applications on. And so finally I was asked to speak about it, and I'm like going, here's what I'm trying to do, but I don't really know the physiology behind it. So it forced me really back into the books and into the literature. And that's, again, I was turned on to Yanda, and of course learned about upper and lower cross syndrome, which I had already been treating, but didn't really know I was treating it. And he also said this one thing. He said, make sure when you're working on anyone that you don't bypass the skin. The skin is just a clearinghouse for the nervous system. With all the cutaneous nerve receptors in the body, it listens to the outside world and responds. And I just went, oh my God, that's what's going on. I think what I'm doing is I'm bending these nerves in a way, because when I put the tab on there, I'll pull it in one direction and ask the patient how that feels, pull it in another direction, see how that feels, and we'll find the direction that the patient says, it feels awesome going that way. And that direction literally kills nociception. And so we were decreasing the neurotransmitter coming out of these nociceptors and decreasing pain in an instant with acute injuries, from shoulder separations to inversion sprains to knee sprains. And so Yanda was the guy that really helped me to explain this when I was asked to say, what's happening physiologically? And so learning about the nervous system, again, from the outside in instead of the inside out, was a real education for me, and took me for these last 30 years down this rabbit hole of improving function. And that's why I've gone into all these different directions, because you can't isolate it with a tape job. Everything's connected. Like when I was in school, they cut the fascia system off the body before we even got into the cadaver room, and now, I mean, how critical is fascia? It's a part of every cell in the system, right? So those types of things, I'm really glad that I've been able to keep the mind open and keep it fresh by learning and traveling with these athletes that demand that I give them the best care possible, surrounding myself with people that are a lot smarter than me and not always necessarily just for my profession. All those things are really important things, so yeah. I know I'm answering you with the long way with these questions. I hope you're getting something out of it.
Yeah, no, I appreciate it. I appreciate all the information. It's really, really valuable. I initially was really curious about you talked a lot about, being the kind of the, as you're called, like the grandfather of functional taping, and how you really developed that system, and, the process that you went through, and the science and everything behind that. And then did that eventually turn into IntelliSkin? Is that how that kind of got developed?
Yeah, exactly. St. John Smith, this guy, he was a world champ at the time in pro beach volleyball. You guys are probably too young to even remember that name, but he was a hero for a long time in pro beach volleyball. And he just, he would call me from all over the world with these various trainers on the phone going, hey, can you talk this trainer through this taping system that you're doing on me? Because I need it to be just like you do it, or I won't be able to compete at the level that I want to. So, he did that enough times for a couple of years, and then finally he just goes, hey, when are you going to make something I can just put on and take off without having to call you up in the middle of the night? And literally at 2:30 in the morning that night, I woke up with a vision in my mind of the first IntelliSkin. And I just saw it perfectly, and it was just like the taping, except for it was made out of one of my old wetsuits. So that's what I did. That at 2:30 that night, I woke up, got the hotel sewing kit, had a wetsuit with me, cut it all up, made a rotator cuff out of the neoprene and laid it on top of the wetsuit, and then fastened it with Velcro. And the next day, I was on tour, and the next day, Sinjin's partner, Randy Stoklos, had a really bad shoulder. But see, I'm 6 feet and 180, and Randy Stoklos is about 6'4" and maybe 240 or something like that. So I got my wetsuit; they fit tight anyways. And he's like, "Man, I'll do anything. Let me try it out." So he put the thing on, wouldn't take it off all day. In fact, wouldn't give it to me at the end of the tournament. So kind of knew I was onto something. In fact, I ended up getting it back from him years later, in exchange, of course, for a new one. But that was kind of the beginning of, oh my gosh, I think we can do something. And so I started it all off with a unilateral support system called the shoulder controller. And then that went into a lot of the Major League Baseball teams were using it in the NFL because nobody had a dynamic shoulder brace at that time. Everything was a limiting your range of motion. And that was kind of the difference in this technique as opposed to a brace. I wanted to invent a system that stimulated the body to do its own work while at the same time dynamically protecting the injury. So that was really the goal, because I knew bracing, though it was important and a necessity, it had already been done. And every time you wear a brace, you become more dependent and you get weaker. So my goal was to create something that interfaced with the central nervous system, that got the brain and the muscles and the nervous system to start working together. Because after you have an injury, that's what breaks apart, right? It's almost like we almost have a mini stroke, and those three systems disconnect. And that's why when someone literally has a stroke, they have to learn to do all these things over again. They've broken all those pathways. And so getting those pathways back is a really, really important thing to learn in your practice, is that when you are injured, and actually before you're injured, the pathways are breaking. Because most of the injuries that we have are very predictable. They're created by the muscle imbalances over time that just kind of create a tipping point. We know that a muscle that's a weak muscle is usually a tight muscle. And a tight muscle doesn't respond as quickly as a loose muscle. And therefore, there's a lag moment when we do certain movements. And that lag moment, I believe personally, is the time that we get injured. So in my practice, when I'm working on somebody, I'm looking all over the body for those areas that have lag moments, those big muscle groups. And I've learned 3 areas that are really critical that I want to share with everybody. And if you're lazy, or if your patients are lazy, if they keep these 3 areas mobile, they will be a lot healthier and a lot less injured. And that's ankle dorsiflexion, so forward flexion on the ankle, hip mobility in all directions, and thoracic spine mobility. If you can keep all those areas mobile, the rest of the areas stay relatively stable, and your body is a pretty happy chamber. So I'm 60-something years old right now, and I'm still continuing to work on that stuff because I'm still an athlete in my own mind, and I surf almost daily. So for me to surf with those young guys out there, I need to stay mobile. So I sometimes even share my secrets with those guys.
Well, thank you for sharing your secrets with us today, and really going into how important that mobility is, and also talking more about IntelliSkin and really, what made it different and what made it stand out from all the other options that are out there. I feel like we've only really scratched the surface of all the knowledge and information that you've gathered over time. Can you provide a place for students to go to get more information about you, about what you're doing, and learn more about this whole kind of field of sports medicine that you've been revolutionizing?
Oh, well, thanks. Yeah, you can go to IntelliSkin.net. That's IntelliSkin.net. Pretty good for a guy with a concussion there, huh?
Really good.
Yeah, how about? And then you can get me at tbrown@IntelliSkin.net as well. If you have any questions for me, look, I was in your boots, it doesn't seem that long ago. It was a while ago. It does go fast, but anything I can do to help elevate the profession, anything I can do to help elevate individuals and save you a step up the ladder, count on me.
Awesome. Well, thank you for that, and thank you for everything that you've provided here today. Such an honor to have you on the show. Really appreciate you taking the time.
Thanks. Let's do it again sometime, Noah.
Yeah, I would love that.
Right on. Stand tall, guys.
Stand tall, exactly. So this has been a production of DC2B Revolution, helping chiropractic students think big in order to live large. If you like this video, please subscribe to the channel, share it with your friends, leave comments in the comment section below, whatever you feel called to do, and we'll see you next time.